asymmetries. So you are just queen of just maximal normal asymmetries. That's a weird title to have.
Oh.
You're not
I thought I was going to fall off the table.
Nobody's fallen off this table yet. I'm not going to have it happen on camera. Good job. Position. Ooh, my hand slipped right off your hair. Okay, but it went. Did the mic get that? Hey, whatever shampoo or conditioner you use, very effective at soft hair. There we go. There was one more right there. Didn't slip that time, guys. Let it be shown. Basically, it's not me, it's you. Okay.
Yeah.
Angela, good to see you again.
Nice to see you too.
Angela is a networking friend of mine. We have run into each other several times at various different events around the town. But she's finally into A, help with video, and B, get some lower back and migraine complaints addressed. So Angela, are you okay if you kind of share with us what exactly we're going to be doing today, or what we're going to be working on, rather? Yeah.
So I have lower back, not issues, but a little bit of pain here and there. I think it's from sitting a lot, and then I used to play field hockey, so a lot of bending.
Yeah.
So the back's just always constantly like that. And then my migraines over the last couple years have just kind of came on. They're not every day or every week even.
Well, I'd hope not. That'd be and they're not every day. Yeah, you wouldn't be.
Yeah.
Here. Okay.
But they happen, and they're pretty hard to do anything when I get them. So I'm trying to work on that and
now,
make the next.
Out of curiosity, how long have you had the migraines for again?
2 years.
2 years.
Yeah.
Okay, so relatively new.
Yeah.
Has anything kind of changed in your life in the past 2 years that dramatic that you've noticed, kind of synced up with this temporally, or?
I think most of the time when I get headaches migraines is when I don't have enough sleep and have something stressing me out or something.
So a heavy stress component to it, okay, as well as sleep.
Yeah.
Restful sleep is important for everything. You don't get enough sleep, you can't name a single thing that gets better. Everything only gets worse.
Yeah.
Okay, so at least you kind of know what your triggers are. Heavy stress, lack of sleep, the lower back discomforts. You mentioned that it's kind of from when you used to play field hockey, bending forward. Do you notice that it's that forward bending movement that kind of aggravates it, or are you not quite sure?
Not quite sure, but I think it's that, and maybe the slouching sometimes if I'm at my desk and stuff.
For prolonged periods of time, you probably well, we'll do a range of motion exam for low back, definitely. To see if there is a movement that might aggravate. Might not be present right now because obviously we only do this for a few seconds. We don't do it for many hours as you would with field hockey or working. And then regarding the migraine component, have you seen a chiropractor before by chance?
Yes. No, I haven't seen them recently, but
when was the last time you saw one?
Maybe almost a year ago.
Okay. So that's fine. I mean, we all fall off the wagon for whatever reason, right? But then we'll also screen kind of your neck and upper back too to see if we have anything that could relate to the migraines there. I did have a previous video on this channel, and I guess we can link up there. So Sarah, if you want to throw that in there, that'd be ideal. Of a girl whose migraines we were able to, I think, outright eliminate or drop down to only one a month. And that was largely a fascial issue, actually. If you want to know the exact science behind that, ask somebody smarter than me. All I know is that we got her better. So hopefully that's something that we'd be able to at least mimic here today. Don't want to make promises, but the bar's high. We're going to aim high for this one.
That'd be great.
So what we're going to do today, we're going to get into the physical exam. We're going to treat you. Do you have any questions about that before we get started?
No.
Awesome. Let's get into it. So Angela was mentioning that she's getting migraine complaints as well as some lower back discomfort. So we're going to go ahead and just screen the range of motion for everything in the spine. Again, migraine complaints can relate to reductions in C-spine ability as well as T-spine because the two are very well connected, and then the lumbar because that's where she has her own episodes of pain. So we're going to get started by getting you to bring your chin down to your chest for me, please. Does that provoke any kind of stiffness or pain, tension, or even a headache-like complaint as you bend forward like that, or no?
It feels like a nice stretch.
Feels like a good stretch.
Yeah.
Okay. Now what if I do something kind of mean and I push it further? Better, worse, or the same?
Worse.
Worse. Okay. So we're going to get you to come back up and look towards the ceiling for me now. How is that? Is that okay, or do we get any kind of pinching or tension through the neck?
That's fine.
That's fine. Okay, again, gonna do something mean.
Ow,
okay, what do we got? What happened?
That hurts a lot. Well, it's just more stress on it.
Okay, so you're not a fan of that movement.
Yeah.
Very few people are, but it's important to note that does make it worse. I'm gonna get you to rotate your head as far as you can to the right for me, please. We can get to about 80 degrees. Good. Rotate as far as you can to the left, please. We can get to about 70 degrees. So a little bit of a decrease on the left side. It's not that dramatic. Usually I see if it's within 10 degrees, it's normal, but it is still an asymmetry. It's the largest you'll get asymmetrical to be considered normal, so we'll screen it anyways. I'll get you to bring your right ear down to your right shoulder for me, please. We can get to about 40 degrees, left ear to left shoulder. We can get much further on this side. We can get to like 60. So there's a noticeable asymmetry in the lateral flexion to the right as compared to the left, so we will be taking a look at that as we feel through the neck too. We get most of our tilting ability from the middle down to the lower neck, so we're going to see if that's where we happen to be locked up. I'm going to get you to give yourself a tight hug, tight hug, okay? Now from this position, I want you to rotate as far as you can to the left. We get to about 50 degrees, rotate as far as you can to the right. We get to about 60 degrees. So you are just queen of just maximal normal asymmetries. That's a weird title to have, but this is interesting to see because you're fine, but you're just on the cusp of fine. Not that there's anything wrong with you. I don't want you to get the impression that there's something wrong, but it's just, this is funny. I'm gonna get you to stand up for me now, please. Please bend down, touch your toes for me, okay? Does that provoke any of the lower back pain there? She can get all the way to the floor, by the way. Her hands are touching the floor.
No, not really.
That's okay?
Just all right. Like my hamstrings.
So just some hamstring pulling, fine. All right, come back up for me. And I want you now to bend backward the other way. If you don't know what I'm talking about, you can see me. Yep, there you can look at the screen there. And that's totally fine too, huh?
Yeah, okay. I feel it in my back.
So what do you feel when you're doing that?
Like in the middle of my back.
Middle of the back. Okay. Like up here even.
Yeah, like.
Okay. So she's pointing more to the TL junction area, okay? And a lot of her extension is coming from her upper back thoracic spine in that case. She might not want to bend at that lumbar spine. I don't know yet. We're going to feel through to see if it's locked up at all as well. Okay. Good stuff. Angela mentions that she gets that lower back pain predominantly when... Are you still playing field hockey?
Yeah, like just like house league now.
That's still fine. Is there one area of your low back where you get it more frequently? Like, could you point to it, or they're kind of like weirdly generic?
It's like all of my lower back.
Whole of the lower back.
Yeah, so it's like hard to point out.
All right. Well, let's go ahead and screen for everything then. I'm gonna go ahead. Keep your knee straight for me. Okay. I'm just gonna lift this leg straight up. And do you get any low back discomfort with this, or just a hamstring stretch?
A little bit in my lower back, mostly hamstring.
Mostly hamstring, but a teeny bit in the lower back, yeah. Huh? Okay. So she's able to get up to 80, 90 degrees with this, which is totally within normal limits. I'm going to get you to slowly lower this leg down yourself now. Does that provoke anything in the low back at all?
No.
No? Awesome. Okay. Now we're going to do the same deal on this side. Bring that all the way up. Anything in the low back? It's
not
okay
really.
if not.
Not
okay,
really.
Yeah, there you go. Perfect. And slowly lower down. Good. All right. I'm going to bring this leg up. I'm going to put my hand behind your hip here. Okay. And I'm going to push through. That's okay. Ooh, what happened there?
My butt is like very tight. I think it's tight there.
Yeah, yeah. Very tender. Okay.
I think it's sore, to be honest.
It's a weird sentence to say, like, my butt is tight.
Yeah.
Be like, I squat, whatever. But yeah, no, like, you got a lot of tension.
It's a heavy leg dance.
There you go. Oh, that's going to make this so much worse for you. That's so exciting.
Yeah.
Okay. All right, and how's the same concept?
Yeah.
Same concept. Yeah. Okay. Drop that knee. Good.
Oh yeah, my hip flexors too.
Hip flexors, you're feeling that like in through the rec fem?
Like more here.
Oh, even up like in the actual hip itself. Okay. 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 Good stuff. So no obvious positive tests with that. We are getting some reproduction of the generic low back pain that comes on when we were doing the straight leg raise. The fact that this gets worse as you probably go for longer in your field hockey tells me that it might be muscular in nature. If you're bent over like this, your quadratus lumborum, your lumbar paraspinals are responsible for making sure that you don't just fall flat on your face, okay? So if those guys are turned on or activated for hours at a time and you're being dynamic and loading through that, it's possible that this could be a technical core insufficiency issue with that, which is where my head is going, because there isn't really a way to test to reproduce that outside of simply throwing you into a game and watching you, right? I like you. You can invite me to one of your games if you want to. Can't say I got time for it, okay? No disrespect.
All good.
Angela, my hands are going to go on your back now, okay?
Okay.
All right, so we're going to start down low. Now, when you do get that low back pain, you said it's kind of generic everywhere.
Yeah.
So to clarify, you're not talking about specifically here or close into the spine. You're talking more like outward. Is that's my guess? Am I correct or no?
Yeah, it's like it's on like it's inward but also outward too.
Okay, so you feel it kind of close in.
Yeah.
But also further out to the sides as well when it does occur.
Yeah.
Okay. So my suspicion about core or muscular insufficiency with the QL is probably well founded here because we are getting that soreness as we continue to play, as we continue to engage out towards the sides, okay? And that is where the QL is. The QL kind of fans out just like that, as well as the multifidus, which is another lumbar erector spinae muscle. So it's probably a muscular complaint. The solution to that is a fully fleshed out rehab program to build up muscular tolerance that he can play for longer, work for longer without getting aggravation. You're still going to get tightness and resulting pain regardless, okay, at least as you are building up your tolerance. So the things we do in here today, the passive care component, it's not going to fix the problem. It might make it feel better, but the solution would be, again, that structured rehab plan, which we can walk through afterwards if we have the time. Otherwise, we'll connect at another point in time, okay? So I'm going to go ahead and feel through. Ooh.
Yeah, I'm really
tender there. Yeah. So that's, again, by that TL junction. That's a very common area of tension that we see a lot on the channel here. TL, with the way that she was bending backward, a lot of the bending actually came from the thoracic spine, not the lumbar spine. To reiterate, lumbar spine is what's supposed to be bending. So it makes sense that we'd get a lot of tension in the paraspinals next to that TL junction, which is very much present right now. Are you left or right-handed?
Left-handed.
Okay, because this actually makes... I haven't felt the right side yet, but she's got a lot of tension on the left side as we creep up, and usually people have more tension on their side of hand dominance, so that checks out.
Like I'm left-handed with writing, but right-handed everything else, so it's probably evenly...
You're evenly locked up?
Yeah.
Well, at least you're consistent, right?
Yeah.
Yeah, okay. Yeah. So I know you don't see a chiropractor very often. Do you see a massage therapist, a physio, an osteopath?
I used to see massage, chiro, and physio often.
You used to be on top of it.
Yeah, and then now I've
And now you're paying for all your own stuff. Am I right?
Yeah.
Yeah, okay, there. Truth comes out.
Yeah.
Oh, Lord. Do you get benefits through your position?
No.
Oh, not yet.
Not yet.
Mm-hmm.
Yeah.
All right. So what I am going to do is I am going to adjust your upper back here. Okay. Now, the first time you adjust someone, there's no way to know how much force is needed in order for them to release. Okay, I've had 350-pound guys on this table I could sneeze on and they would release just fine. I've had 100-pound ballerinas I've had to all but literally body slam. So with you, we're going to start light, obviously. And as necessary, we'll add more pressure if needed to get the kind of release we're looking for. Sound good?
Yep.
All right. So I'm actually going to whip off the bracelet for this because sometimes it gets in the way. All right. So I'm going to get you to start by taking a big breath in, and you're going to breathe out fast, like getting out of your lungs, okay?
Okay.
Big breath in, all the way out. Good. In, all the way out. There was another small one. In, all the way out. Okay. We got some, but there's definitely more work to be done. I'm just going to turn your head. And once again, not the easiest adjuster, I'll tell you that for free. Also don't want to hit you any harder because we'd have 1,000 internet witnesses to it. So that's a joke, guys. Okay. Now, while you are in this position, you mentioned that you do have some discomfort kind of in the glutes, okay?
Yeah.
Is that a regular thing for you, or is that more due to the fact that you just crushed a heavy leg?
No, it is.
It's a regular thing for you.
Yeah, it's regular.
Okay. So with your permission, I'd want to feel through to see if there is any excessive tenderness at this point. Okay? Yeah. So 2 primary muscles that I like to screen when we're working in the glutes. First is the glute medius. Okay, we have 3 glute muscles. Everybody knows about the glute max, which is kind of like the big one. We got the glute med, which is the middle child, and then we got the glute min that doesn't really do anything. But the glute med, that's a lie. It assists the glute med, but it doesn't do as much as the glute med. Okay, there you go, scientific community. All right, glute med, kind of right out in this. Okay.
Yeah.
She immediately winces up with that. Okay, so that's on the left side. Yeah. Let's check out the right side. Not as bad.
Not as bad.
Eh?
Yeah.
Okay. So that's the first one. Definitely very, very tender on the left.
Yeah.
Also the piriformis muscle. That's the other one I like to screen for. So the piriformis connects from the sacrum, which is the bottom bone of our spine. The bottom triangular bone kind of looks like this shape about. And it connects out into the greater trochanter, also known as the kind of pointy hip bones that we have on the sides of our legs there. So the piriformis, I'm going to lift this leg up. I'm going to kind of, very politely, jam my thumb on it and then rotate you like that. Is that okay?
Yeah.
Somewhat, a little bit, not really?
Yeah.
Not as bad as the glute med, though.
Yeah.
Okay.
Yeah, it's just tight, I think.
Obviously. Okay, let's go ahead and try it on this side.
Oh, that's...
Worse on this
side?
Okay.
Yep.
Yeah, we're gasping, so we're going to work on these areas just a bit here. Because I know from personal experience, having tight and spasm glute muscles feels awful.
Yeah. I like the figure 4. It helps with
the figure 4, like sitting position? Yeah.
Or on the back, it doesn't matter, but yeah.
So if at any point in time what I'm doing here hurts too much for you, suck it up.
Okay.
I am, of course, kidding, and you know that. Guys, we're kind of friends, so she understands my humor. But if you think that I'm unprofessional, please feel free to remind me in the comments below, okay? You're tough and you're strong, okay?
Yep.
I know!
Not to say anything.
So strong!
Oh my gosh.
Okay. Here's the first. Fortunately for you, the piriformis is not as bad on this side.
Yeah.
Did I speak too soon?
Nope. It is still better. I'm like, if I ever feel like it's painful, I'm like just thinking about the other side and how worse it was.
No. Mm-hmm. If you need a reminder, I can switch back to the other side.
No, it's all good.
Okay, just thought I'd offer that. What I'm going to do here is I'm actually going to get you to lay on your sides facing the window, please. Okay. I'm going to bring this up for your head. Okay.
Doesn't matter where I put my arms.
You can just put them right there. Okay. So the glute med, right here, I'm going to put my elbow in it, and when I do, I'm going to get you to bring this leg forward. You can bend the knee a bit.
Okay.
And drop it off the table like that.
Okay.
Okay? So, from this position, I'm going to take that elbow, put it right there, go ahead, bring that leg forward, and drop it off the table.
Okay.
You okay?
Yeah.
Yeah, I can tell from your facial expression over there. Yes. Okay. And come back up. We're going to do that 10 times, okay? 9 more.
9 more?
Yep. Okay. Bad news for you, I really suck at counting too, so this might accidentally be 15. 4, I think.
Yeah. Why 9?
What comes after 4? I can't remember.
Oh.
6. 7. 8. 2 more.
2.
9. I can't remember what comes after 9.
10.
Is it 10? Are you
that's
sure?
good. Yeah.
Oh, okay. Good job. You're almost in the right position there. I'm going to take this, pull you right there, and get you to just hold right there for me. Thank you. Going to bring this up. Scooch the hips towards me, please. Come.
Oh.
You're not
I thought I was going to fall off the table.
Nobody's fallen off this table yet. I'm not going to have it happen on camera. Okay, so you're in the right position here. I am going to roll you further towards me. You might feel like you're going to fall. You're not going to because my leg is right here. Okay? You can't see it because your head's up here, but you just got to trust me. Okay? So, going to roll you towards me. Good. Good job. Easy, right?
Yeah.
No pressure.
Yeah.
We'll get you on the other side, please. Again, you're almost in a good position here. I'm going to go ahead and take this arm, and hold just like that. You're going to bring this leg upward. Relax this hip for me as best you can. Good. And same position. Roll you towards me. You're okay. Good job. See? So simple. You're a pro. Have you had your low back done before by the other chiro? Wow.
A long time.
My voice went really high with that. Okay. I'm going to feel through the neck here, okay? Is a turtle your favorite animal there?
No, I got it as a gift from my boyfriend.
Okay. Fair. I figured it was a safe guess.
Yeah.
But. All right, so we're feeling through that neck. Remember, oh, wow, okay, that's a little bit tender right there, isn't it?
Yeah.
Now, remember, we did have some issues in flexing to the left, I believe. The left side was a lot more reduced compared to the right, which tells me that the left side wouldn't want to, or the right side, wow, that got really confusing. I'm going to do that again. We are restricted in laterally flexing to the left, which tells me that the right side is locked up and doesn't want to release. That's my understanding of it. Hopefully that one made more sense than whatever word vomit I just had. But okay, so let's go ahead and poke through, and definitely on that right side, we're quite tender, as we can tell by her wincing face. So. You're a good sport, Angela.
Thank you.
Now, you said you've had your neck adjusted before, yes?
Yeah.
Perfect. And that all went well for you? Do you find that helps the migraines at all? Back when you had them? Or you weren't sure?
I don't know.
You don't
I'm
know?
not sure.
Okay. Well, you've had it done before, so you're familiar with the whole process.
Yeah.
Good. No, it's okay. That's tender right there. I'm going to stop torturing you now, and I'm going to actually kind of adjust you. So what I need from you to get this to happen is I need you to rotate as far as you can to the left for me. Okay? And then just relax your head in my hand as if it's in a pillow. Okay? In, on, you know what I mean.
Yeah.
From that position. Ooh, my hand slipped right off your hair. Okay. But it went. Did the mic get that? You okay? Yeah. All right. So make sure you have good contact when you do this. But that still worked. Okay? So she needed that badly. Okay, whatever shampoo or conditioner you use, very effective at soft hair. We're going to try one more time for a little bit lower down. There we go. There was one more right there. Didn't slip that time, guys. Let it be shown. Yeah. Basically, it's not me, it's you. Okay.
Yeah. That's fair. Yeah.
All right, let's check out the left side. Not as bad on this side, huh?
No, it's a lot less painful.
Okay, so that really checks out with the decreased left-sided flexion, and I believe the rotation was reduced by like 10% as well. So that makes sense to me. Definitely a right-sided issue, but that's okay. Ooh, there we go.
Tight.
I found one right there.
Yeah.
Always be looking. Breathe and just sink, okay? I know it's much easier said than done.
Yeah.
Okay, let's handle that. I'm going to bring this microphone over.
Can't let it not hear it.
Of course not. That's why people click on chiro videos. I know it's not for the rehab and exercise. You guys showed me that. Oh, for the rehab and exercise.
No.
I was going to say a blatant lie.
You kept speaking, but that's not why I watch them. I watch them for the crap.
Exactly. All right. I'm my own worst enemy. I talk too much.
So do I.
So much in common.
Yeah, I'm a yapper.
All right. Let's handle that little area right there. Good. Drop for me. Just again, relax. I promise I won't slip this time. Nope. We got it. Probably shouldn't have talked again on the note of talking, but we got it. Okay, that feels a lot better to me. Good job. Proud of you. Now in this clinic, I've seen pretty good results with instrument-assisted soft tissue therapy, especially in the upper back neck area, to handle or at least improve upon migraine complaints. So what we're going to do today is we're actually going to just scrape everything, because yes, we got the lower back discomforts, but I want to do all of this too to see if it has any contributory effect to her perceived migraines. So I'm going to put the gel on you now. Might be a little bit cool, okay? Just that you know, I don't want you to jump and be too... Oh, there we go, you jumped. Okay. Yep.
I felt it coming, but I was like, ah.
You're okay. We are almost out of this bottle. It's going full ketchup bottle right now. Okay. All right. So now, Angela, while I do this, okay, I usually like to ask the patient a question about themselves. You're ticklish, aren't you?
Yeah, I am.
Fantastic. Okay.
This is gonna be hard.
This is gonna be really difficult. So.
Ow.
Okay. This is gonna be fun. I want you to just take deep breaths for me instead then, okay?
Yeah.
If you feel comfortable, if you feel able, I want you to share something about your job that you find rewarding, okay? But if you need to just focus on not squirming on the table, you let me know and you can just breathe deep, okay?
Okay.
Yeah. So tell us something about your job.
Well, so I work in the recruitment kind of space, so
Okay.
I find it really rewarding. Not only, like, obviously we're serving companies to help them fill roles and their frustrations, but I honestly love meeting new people and, like,
Okay.
getting to know them, and, like, I almost feel like every time I, like, meet someone and, like, interview them, I'm almost, like, getting to know someone and, like, helping, like, match people. So I think it's, like, really rewarding because it's, like, a win-win for both parties. So
Mm-hmm. You're like a matchmaker for jobs.
Yeah, and it's great. So I like that, but I also, like, I don't know, I love talking to new people, meeting new people, making new connections. I like that I get to network in my job, so
Good.
yeah.
It's really, really good that you enjoy networking.
Yeah,
okay,
I do.
like understand. So for you guys watching at home, if you haven't started your own business before, if you haven't had to obtain your own clientele or patient base or whatever it is, networking is what a lot of people throw around as like the thing to do. All right, which is going around meeting as many people as you can. I prefer to think of networking as the grown-up adult version of socializing. All right, so a lot of people, like, who doesn't like to be social? Definitely some people find it exhausting, but it's much better if you think of it as you're just socializing, you're just hanging out rather than networking.
Yeah.
And it is important to do that, though, because life, if it's taught us anything, it's not what you do, it's who you know. It's the people you meet. Don't pretend like this isn't true. So, you know, really good that you enjoy doing that. If you keep up that skill set, if you keep up that the fact that you like that, that's only going to benefit you so much as your career grows, okay?
Yeah. No, I just...
Oh, that's how we met.
Yeah,
Like,
exactly, yeah.
mhm.
No, I just think it's, like, fun to, like, kind of know how people, like, got to where they are, and, like, just, I don't know, I think it's cool. It's just
It
fun
is
to
very cool.
chat. Obviously, not every night I'm like, oh my god, I can't wait to go...
Oh, no, not at all. Sometimes I just want to sit at home and play Elden Ring or a video game, right?
Exactly, so it's all about balance.
Okay, so this is the crowbar. All right, as I like to call this massage tool. Is this ticklish or painful for you?
Like, both.
That's a really weird combo.
Like, mostly ticklish?
Well, that's better than mostly painful.
That's tickle.
Coochie coochie coo. Yeah. Okay, so we are getting some of that redness showing up right in this area. We're probably going to be getting it in other places too, okay? So you just try to sit tight as much as you can. I think I already know what the title for this one's going to be. She Can't Stop Squirming, Too Ticklish, something like that. Breathe. Good.
Yeah, it's not painful. It's literally just ticklish.
That's weird. I get some of those people on occasion. Wasn't expecting it to happen on camera today, but here we are.
I think it's because I'm so, like, my, like, muscles are all so tight.
Breathe.
So that's why it's hard.
Sink into the table. You're correct. That would definitely be making things a little bit harder.
Yeah, that's probably why.
When was the last time you had one of your massage therapy appointments?
Like a year ago, like, just like my chiro.
Do you squirm on the table
Yes.
with them too?
Yeah.
Okay,
Yeah.
good. So this is a reoccurring thing.
Yeah, no, it's not just, it's all, it happens.
Again, not me, it's you.
Yeah.
Okay.
Yes. I anticipated a different direction, so I was like, oh.
tough and you're strong. You're tough and you're strong.
Yep. This is so ticklish.
It's better than painful.
Yeah.
Believe me,
Yeah.
I've had patients squirming on the table exactly like you in pain.
Okay.
Instead, okay?
Yeah.
So, like, pick your poison.
Yeah.
Yeah, as anybody on this channel would know, when I do massages, it's not for people to feel good, it's for people to get better.
Yeah.
So.
Yeah. That's like the only type of massages I've really had, so
Fair.
people are like, oh, like,
It must be so relaxing.
I'm like, no,
No.
it's like tissue massage. Yeah, no, it doesn't.
I pay a person and they beat me up,
Yeah.
actually. That's the way that it goes. Yeah.
If it doesn't kind of like make me do it, like then it's not really good massage in my opinion.
Well, I can go a hell of a lot harder.
No,
if you'd
no,
like me
this is
to.
good. This is good.
Okay. Well, standing offer. Okay. Yeah, definitely. Yeah, all kind of throughout the upper back there. So just so that the camera can see, I'm going to pull that kind of down. Yeah, quite a bit. That's a thumbnail. Okay.
Is it?
Yeah, do you want to?
Oh, whoa, it's
Yeah,
so
let
red.
me pull up there. Yeah, there you go.
Oh.
So definitely for certain.
Wow.
I guess you go face down once again. Thank you. You're tough and you're strong, okay? Is that ticklish? How?
Uncomfortable. Like
Okay,
what?
okay. I thought you said it was ticklish. I was like,
That
this is
one's
not
not as much
ticklish.
ticklish. That one's just like. Ugh.
That's a lot, I know.
Yeah. But I wouldn't say it's like painful. It's just like. I don't know.
You're allowed to change your opinion if you want to. Breathe. Why do all my patients always forget to breathe?
I always forget to breathe.
So long as you remember
It's
to
a
at
common
some
occurrence.
point.
It's a common thing. But I started doing Pilates, which is all
Good.
about breath work.
Very good.
Yeah.
Pilates is a great form of exercise.
And it's like good because I feel like my mobility's lacking. So I need to like kind of do some more like.
Your mobility is not necessarily lacking, but it's okay. I take that back. It's lacking in some places,
Yeah.
but it's hyper compensatory in others as a
Yeah.
result. So yes, Pilates would be a great form for you.
Yeah, because I was doing F45 and I liked it, but I feel like I needed to like go back to my like regular gym routine, and then I'm just gonna mix in Pilates. So.
All right. Okay. Good. Do you find this ticklish?
A little, but
Okay, not as bad as the tools?
no.
Good. Now I'd also want to do this in the glute structures that we worked on earlier. Is that okay?
Yeah.
Perfect.
Oh my god.
Breathe. Ready to tap out?
Yeah. Oh my god.
Good job. Angela, how did you find, we did quite a bit today in a very short period of time because we're on a time crunch, but how did you find all of that?
It was good. I felt it every little thing you did. I was like, okay, like
Something's
working.
happening.
Yeah.
Have you ever had the tools done on you before?
No.
That kind of, yeah.
No.
A lot of people, for whatever reason, when they come in here, they've never had that kind of technique used on them before. Did you know what fascia was before you came in here?
Like, not really.
Not
You explained it, and I
particularly,
was like,
yeah.
oh, that makes more sense.
Okay. A lot of people haven't even heard of fascia, which I've explained on this channel many, many times. But if you have a reoccurring pain, a reoccurring musculoskeletal issue, just go get your fascia addressed. I feel like a lot of people don't give it the attention that it needs. Okay, so yeah, today we adjusted, we did the fascia release, we did some massage. We'll talk exercise recommendations after this. Do you have any kind of questions or comments, concerns about like anything that we did in here? Anything else you want to know? Next steps?
Maybe, like, what do you think? Like, obviously, I came in thinking I had whatever issues, like lower back, migraine, but did you find that something else was the bigger issue?
No, like, again, based off the fact that we had very limited physical exam findings, okay? Like, we had a little bit of discomfort on that straight leg raise, which could suggest to us it's either like a bit of an SI thing or a disc injury, but you're not getting any pain down the leg, okay? Which is pretty characteristic. Like, I saw a disc injury earlier this morning, okay? So you're not fitting that profile. The history component in this case says that, like, you feel this low back pain come on after sitting for a prolonged period of time, after playing for a prolonged period of time, right?
Yeah.
Both of which you would be engaging your QLs, your paraspinals, for a prolonged period of time. Like in field hockey, you'd be like this, and when you're sitting, well, most people will slouch, okay, if they remain for too long. That is slouching, understand, is the same movement as bending forward, okay? Like you're doing the exact same movement pattern. Your body doesn't understand the difference, okay? But if you maintain that for prolonged periods of time, you would obviously aggravate the complaint. So I think it's a muscular insufficiency. The easy workaround of that is to change up your sitting posture during work. Consistently moving around is better than any one position stationary for hours on end. And granted, I'm not a field or even a hockey player, but finding some way that you're not constantly bent over during your game. Now I understand that that's probably not really possible, which is why we would want to find an exercise routine that could better support your sports goals, which we can do, okay? But especially like for the work, which like objectively you don't have to play field hockey. You should because you want to, but you don't have to. You do have to work, right?
Like a standing desk?
Standing desk is great, okay, because you need to constantly kind of be shifting your weight around, but even just moving around in your seat, right? For a lot of patients, I will recommend an application on their phone that lets out a very gentle, non-intrusive chime every 25 minutes as a reminder to just change your position. That can be from this, to this, to this, to whatever. Doesn't matter what. Does that answer your question?
Yeah, that's good.
Perfect.
Yeah.
Do you have any others that you want to ask for today, or?
Maybe like moving forward, what do
Yeah.
you think that the best like treatment would be for me?
Best treatment for you is going to be a strengthening routine.
Yeah.
Okay, so that's going to be, we'd go in the gym. Okay, I am inside of a gym here, and we would be focusing on finding ways to build up the resiliency of your core. Okay, you're already doing Pilates, which is phenomenal. Okay, like Pilates would actually directly help this condition, but I would want to look at more, like I have a big strength training background. I'm talking like heavier weights, you know, more sets, stuff like that. So I would want to find ways to strengthen the QLs and the multifidus and in fact the obliques, the core, just the full core. And that should translate to longer periods of tolerance in game, okay? That would be my next steps for you. The things we do in here are great at pain management, but exercise is the big thing that's gonna help you to self-manage. Every patient in here does get an exercise routine. I just don't show it on camera because again, you guys click off. So, any other questions?
No.
No?
I think I'm
Okay,
good.
awesome. Well, really good seeing you again, Angela.
Yeah.
We gotta actually get going to a networking event ourselves right now. So, take it
Thank
easy.
you.
I'll see you there.
Thanks. Don't forget to like, comment, share, and subscribe.
Thank you so much, Angela.